In this video, we're going to be looking at the technique for supine leg raises or lying leg raises. So a key point to note with this exercise is it's working the abdominals and the hip flexors. Now the abdominals attach between the rib cage and the pubis, this bony prominence right here. Now if I lengthen my abdominals, it increases the distance between the pubis and the rib cage, so the abdominals are lengthened. We also get an anterior pelvic tilt where the pelvis is tilted forwards. Now when I engage my abdominals, it shortens that distance between the pubis and the rib cage, and I get what's called a posterior pelvic tilt, so it flattens the lower back. Now when I'm performing a leg raise, as I raise my legs up, the abdominals are shortening, so it's the concentric contraction to bring the legs up. That's going to reinforce that flat back position. However, as I bring the legs down during the eccentric contraction, yes, we want the abdominals to lengthen, but we don't want them to lengthen to this position where we get an anterior pelvic tilt, we get a curve in the lower spine, and essentially we're taking away the tension from the abdominals. So the key to this exercise is to maintain that flat back position. Now a way of regressing that position is to place the hands under the glutes, which essentially just blocks the pelvis up and maintains that lower back position. So let's take a quick look. Laying flat on my back, pull my pelvis back so my lower back is flat. Hands to the side, raise the legs, come up to the top. We can even crunch at the top and increase the range of motion. From there, lower the legs under control. The abdominals are lengthening. However, we maintain that flat back position before raising back up. So huge level of contraction on the abdominals. Quick look at how placing the hands underneath the glutes will just maintain that flat back position, making it much easier. Just a quick point to note when it comes to supine leg raises is some people do experience pain or discomfort in the lower back because there's a lot of stress coming from the hip flexors, so the psoas major attaches to the lower spine. So when we're performing this drill, often the psoas major is pulling on the lower spine and we can find it uncomfortable. If that's the case, I suggest going on to other core exercises to build the abdominals and the hip flexors before progressing to this one, and hopefully you don't experience the same level of discomfort or pain.